I'm working at the Norwegian National Center for Aging and Health, and that is a multidisciplinary center where we look at how we can improve elderly health and do dementia prevention and increase quality of life with people who are aging and also have dementia or other chronic diseases. And we're doing it at like a system level where we have educators as well as policymakers and therapists and researchers, and trying to see how we can improve lives of elderly people in Norway. I would say definitely the people. I've met so many lovely, interesting, inspiring people here from all different levels of mental health and healthcare and policy making and researchers and therapists. And it's at a larger level almost the same as my institute at home, but from all over Europe. So it's a very, very interesting and an inspiring group to talk to and work with and share ideas with. So like that's definitely been a huge highlight for me. I think there's a lot of people here who have very hands-on experience, which is very, very interesting to me because I don't work so much with actual patients or people who might be affected by my research. So I have more of the theoretical aspect of kind of mental health care. But I think I would hope that I, on the other hand, maybe contributed more with the theoretical framework. And I've had some really interesting discussions about the ethics of different kinds of research and how to kind of test some of the approaches that people might be wanting to be using, because there's a lot of anecdotal evidence and maybe not always as much clinical and theoretical evidence, which of course also is sometimes important to look at. Oh, well, I've seen so many lovely things. I love about Helsinki that, we have the nice parks here and some really beautiful islands. I went to visit Semilina, which is one of the most interesting places I've visited in all of Europe, I want to say. It's beautiful archipelago and the military fort. And the architecture here is like so beautiful. So I've seen a lot of very interesting architecture, and in Tampere I've also seen this observational tower where they apparently have Finland's best donuts. So you can have a coffee cup and a donut and have this amazing view of the lakes. So that was really nice. And I've learned a lot about the history of this area, both because I have like a very interesting background with Finland and Sweden and even Germany. So it's a very multicultural place. I would definitely recommend this program. I think it's, I think it's so enriching to talk to all of these different people from all over Europe and also different, as I said earlier, different layers of the healthcare system, because it is extremely inspiring and educative. I've made friends and contacts with people all over Europe, and just yesterday I talked about a potential research project that we might want to do. So that's a really, really lovely opportunity that I wouldn't have gotten otherwise. So I definitely recommend anyone to try to get into this program.